Hi everyone, this is Dr. Priyadatt Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. So, before few days, I came across a very unique question from the patient of endometriosis. Patient ने पूछा हमें कि सर मुझे endometriosis के साथ में PCOS भी है. This is not a routine question, you should understand that PCOS and endometriosis दोनों साथ में होना या हो सकता है वो एकदम डिफरेंट चीज है, पर वो क्वेश्चन हम लोग डेली फेस नहीं करते हैं because both the entities are different. But the question is, can PCOS or endometriosis exist together? To answer this question, you have to understand what is the PCOS and what is the endometriosis, how it takes place, what are the symptomatology, how it affects the reproductive organ and fertility outcome, and what are the possible treatments. So after understanding this, it's easy for me to convey that both these conditions may sometimes coexist in a same patient. So first understand PCOS and endometriosis by literature can exist together. Why it exists together? Because in both the condition the estrogen level would be very high. So the growth of the endometriosis is also estrogen dependent, and in PCOS the estrogen would be very high. And by literature we can say that patients who are having PCOS, they are prone for endometriosis. They are kind of having a possibility of in future development of the endometriosis. But हम लोग हमेशा ऐसा नहीं देखते हैं. What I am conveying right now is practically what we are seeing in OPD. In endometriosis, basically it is occurred due to ectopic implantation of endometrial cell outside the uterus, mainly on ovary, peritoneal surface, rectum, bowel, ureter, parametrium, everything else. Wherever it gets implanted, it basically grows under the influence of estrogen hormone, and based on this growth, generally nodules and chocolate cyst and endometriotic glands and everything develops. In a PCOS, generally it is the condition which occurred by birth. Its presentation is always going to be by birth, and due to the high number of follicles inside the ovary, good amount of stroma, the ovaries are bulkier, and with this kind of a presentation, hormonal imbalance totally takes place, and that leads to a symptomatology in patients of PCOS. So practically speaking, what is happening in our practice is, in endometriosis, when it is developed and the ovaries are affected, the reserve goes down, because generally the normal ovarian cells and tissues and follicles are only affected in cases of endometriosis. In PCO patient, the number of follicles are many, mainly minimum should be around 15 to 20 in each ovary, so they are very high, so reserve is always going to be higher side. In extremely less instances, we are seeing a patient of PCOS with normal or low ovarian reserve purely due to hormonal fluctuation. They are having a symptomatology of PCOS. We strictly speaking regarding the fertility part and symptomatology of both these conditions, symptoms mainly related to the period. Apart from painful period, irregular bleeding, heavy bleeding, passage of blood clots, polymenorrhea, delayed period, everything can be overlap in both the condition, endometriosis and PCOS. But in endometriosis, main presentation is severe pain during the menstruation, that is painful menstruation. Along with that, few of the other symptoms like pain during the sexual intercourse, mid-cycle pain, premenstrual spotting, and also sonographically both the ovaries are distinct. In cases of endometriosis, we can see the chocolate cyst, endometrioma, whatsoever the size is. In PCO, the pattern of the ovary in sonography is totally different. It's kind of a necklace pattern where the follicles are mainly arranged in periphery and size of the stroma would be high and ovaries are quite bulky. In endometriosis, the AMH values are, we are seeing a patient with normal or high AMH with endometriosis, but mainly a major chunk of a patient, their problem is regarding the oocyte quality, number of antral follicle count, AFC, and AMH is on lower side. In PCOS, they have a problem with the ovulation. Their AMH is comparatively very high, maybe more than 5-6. Number of follicles are also very high. As far as the practical purpose is concerned, basically as far as the ovarian reserve is concerned, both the patients with endometriosis and patients with PCOS, they are of opposite spectrum, where one side the reserve would be very high, when the other side the reserve would be on lesser side. But as far as the fertility is concerned, both the patient can face the fertility issues, but the problem for the fertility or the mechanism for infertility is different in both the patients. Fundamental issue of infertility in PCOS patient, you should understand that it is an ovulation, the patient is not having the ovulation. So if patient don't know their fertile date or ovulation date, they are going to face the difficulty in having a pregnancy. That's the main fundamental issue as far as PCOS is concerned. But in endometriosis, the problem with the fertility have a many different mechanism. First is oocyte quality, second is tube-ovarian relationship, third is chemical milieu, fourth is low ovarian reserve, fifth is due to altered anatomy of the pelvis, and sixth is difficulties during the intercourse. Apart from that, many other reasons are seen, but mainly these are the reasons we are seeing in practice. So as far as infertility is concerned, we are not talking about other symptomatology because the symptoms of pain in endometriosis, the treatment is different based on the disease severity and everything. Symptoms of sexual intercourse related issues, the treatment is different. In PCOS, same way, the irregular period, the treatment is different. Hirsutism, that is abnormal hair growth over the body and skin, the treatment is different. Hormonal irregularity, the treatment is different. But we are only talking about the fertility issues. The treatment is directed to the possible underlying reason why the fertility issues are there, and that reason in PCOS is different, that reason in endometriosis is different. So in PCOS, the ovulation is the issue, so we direct our all power. As far as other factors are normal, including tubal patency, our focus is always going to be on the ovulation. So if patient can ovulate and we can determine the time of ovulation, they can have at least a chance of conception. Why? Because the oocyte after ovulation, the life of that oocyte inside the body is around approximately 24 hours. So that window is very important as far as fertility is concerned, and majority of the patients with PCOS are getting good outcome if the treatment is directed on this side. But in endometriosis, we have to see the overall picture where the problem is, because kind of a PCOS, there is no single cause which is responsible for endometriosis. So we have to assess and focus all our efforts towards the all front where the endometriosis can hamper the fertility. Whether patient requires ovulation, whether patient requires a laparoscopic surgery and correction, whether oocyte quality is compromised, whether the endometrioma is huge in size, that surgical correction favors the benefit to the risk of keeping the endometrioma inside the ovary. How much is the AMH, the decline rate of AMH, age of the patient, how hurry the patient and their family is to have a pregnancy. So lots of factors we are thinking about that based on the stages, sonographic finding, laparoscopic criteria, symptomatology, other symptomatology than fertility. We will decide a tailor-made approach for that particular couple, and then we proceed according to that and try to give them a maximum possible benefit as far as pregnancy is concerned or fertility is concerned. But rarely over a year or two we are facing patients which can have both the problem coexist together. So if we are getting a patient who are having a very high ovarian reserve, kind of a PCO patterns ovary, along with endometrioma or chocolate cyst or endometriosis, we feel we are lucky as far as fertility consultant is concerned. We feel patient is lucky as far as patient have a condition of both PCOS and endometriosis together. Why? Because the biggest concern as far as fertility consultant is concerned in cases of endometriosis is poor ovarian reserve, poor oocyte quality and low AMH. So these three condition has been countered by coexisting condition of the PCOS, which is kind of a not everyday's presentation, but few of the instances we are seeing it. So in spite of having a chocolate cyst or endometriosis, ovary have a huge number of follicles, huge reserve. So our approach in that kind of a patient for a fertility is little bit different. Our kind of a aggressiveness for surgical outcome in that kind of a patient is little bit different. 2 years back we have one patient who have a endometrioma along with PCOS. Her AMH was 5.6 along with 4 centimeter chocolate cyst. We give her a fertility treatment. We tried really hard, and after 4 months of treatment she was carrying a pregnancy, that is a twin pregnancy, delivered at 36 week, healthy twins, and that went without any problem. So yes, both can coexist, but it's not always so because the entity is totally different. Symptomatology, underlying mechanism of infertility and other symptoms are totally different, and treatment approach is also a bit different in both the conditions. So if you have any queries regarding this, you can consult your healthcare provider or you can contact us. This is Dr. Priyadatt Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. Thank you so much.